Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center. Today we're going to talk about the progression of diseases, and the disease is brain fog, or ultimately it can lead to dementia if the underlying cause of the brain fog or memory problems or concentration difficulty is ligamentous cervical instability, or a breakdown of the neck curve called cervical destruction. And we all know that you can have a little bit of brain fog or a little bit of fatigue just because you're doing too much, right? But if the symptom starts progressing, you're like, geez, I used to wake up with energy, now I don't have any energy. I'm having a harder and harder time doing my job, right? Because most jobs now involve computer work. You have a little bit of anxiety, you have maybe a little bit of depression, right? And it's slowly getting worse and you don't know why, right? If you have a breakdown of the neck curve, you have ligamentous cervical instability, and you don't do something about it, it progresses and the brain symptoms basically progress. Dementia or brain atrophy, right? On MRIs, they show the brain shrinks and the fluid in the brain accumulates and brain pressures go high, and you ultimately get death of brain tissue, which ultimately leads to Alzheimer's disease or dementia. We all know this didn't happen overnight. It might have happened over 30 years. Though in China, they recently diagnosed a person with Alzheimer's disease and they're only 19 years old. And I have no doubt soon we'll probably have a teenager in America where they diagnose them with full-out dementia. And I think there's a structural cause of most dementia. And the structural cause is, well, basically it's here. You get ligament damage in the neck, right? The neck curve's supposed to be like that. When you look at cell phones, the kids are pretty much, they're all addicted to cell phones. Then all of a sudden, the neck curve is like that instead of like that. Well, the atlas then pushes into the jugular vein. The jugular vein is the main drainage port. That's where the fluid in the brain goes. And what happens is the waste products can't get out of the brain, right? So the brain becomes a toilet, right? There's just brain poop all over. The brain poop is all the metabolic activity, all the work the brain has to do because of all the visual input that we all give our brains every day that we don't need to, right? All the internet surfing, all the social media, all the YouTube videos, all the shopping we do, all this stuff is work for the brain. Well, the neuron, the 5 billion or 1 billion neurons in the brain, all this activity causes them to make metabolic waste products. Well, when the metabolic waste products accumulate in the brain gets polluted. Some of the waste products include beta amyloid and tau protein and all kinds of inflammatory substances that basically can destroy the brain and ultimately cause the death of brain tissue, which we know as dementia. So basically teenagers, when teenagers come into the office here, this is a 17-year-old, a myriad of symptoms, and often brain fog is one of the symptoms. Brain fog is the number 3 thing we see at the Hauser Neck Center. Number 1, neck pain. Number 2, headaches. Number 3 is brain fog. So I'm making this video. Brain fog should not be treated lightly, because brain fog can progress to memory problems, which can progress to all kinds of brain problems, difficulty concentrating, severe depression, severe anxiety, severe personality changes, obsessive compulsive disorder, and all kinds of terrible things that can happen to the brain. So the ligamentous etiology of brain fog, right? You have ligament injury, the brain or the neck curve reverses, blocks the jugular vein, and ultimately you get an increase of waste products in the brain pressure goes up because the fluid can't go out, and then it gets progressive. So this is just total of 931 new patients came to the Hauser Neck Center in 2022. I just wanted to give you an idea. That was in 2022. That 73% had fatigue, 73% had neck pain. Look at anxiety, brain fog, headaches, difficulty concentrating. You know, you can see that there was a lot of brain symptoms, if you will, but the brain symptoms are from a neck problem. And then almost all people who have concentration difficulties, problem-solving problems, they're having harder and harder time at work, or even managing a household, right? They're having a harder and harder time. They can't read anymore. They just got to look at like various videos or YouTube, like reading. You know, people can't read anymore because the brains don't have the energy to read. So these are all signs that there's a brain problem, and the brain problem can come from a structural neck issue. So if you have a lot of these symptoms, I'm just telling you there's a good chance that you have a ligamentous cervical instability issue, or you have a bad change of your neck curve that you need to correct. And if you don't, these things are all going to progress likely. Now, some of the signs that there's a neck problem is there's clicking, popping, grinding in the neck. It's associated with headache or neck pain or neck stiffness. Or you have been a long-time patient of a chiropractor and you know the things are still progressing. These are all signs that you have ligamentous cervical instability. Now, the ligaments connect the bones. So when the ligaments are weak, the bones can sublux or move in positions that they shouldn't. So if you go to a chiropractor and the bones are always moving out of alignment, you have all these misalignments, atlas misalignments or other misalignments, it's most assuredly that you have a ligament problem. And the ligament problem can be addressed by prolotherapy. Prolotherapy injections to tighten and thicken the ligaments can stop that and hopefully resolve the symptoms. So see the big jugular vein, that's the drainage port of the brain. So when the atlas or the cervical curve changes in a bad way, the cervical curve, instead of going back, it goes forward. That can block that. And the problem is when it blocks it, right? When it blocks it, when you have obstruction of brain, veno-lymphatic drainage because the jugular veins are blocked, the brain pressure goes up, toxic metabolites accumulate, and you can get brain neuron cell death and atrophy of brain tissue. Another interesting thing is often you get heat intolerance because the metabolic activity of the brain is greater than the rest of the body. Give you an example. The brain weighs about 2% of the body weight, but it consumes 20% of the energy of the body. So 10 times its weight because there's so much activity in the brain. And what that does is it causes the brain to be about 2 degrees warmer than the rest of the body, 1 to 2 degrees warmer. So part of the fluid flow issue is to reduce the heat. Like you guys know, if you don't have good oil in your car, the oil helps the metal parts that are moving near each other not generate a lot of heat. If you don't have oil, there's going to be so much heat that the engine will freeze, the metal parts will stick together, and then you basically have to get a whole new engine, which is thousands and thousands of dollars. So you're better off just getting your oil changed. So the same thing happens with the brain. If the jugular veins get blocked, the brain can heat up excessively, and people are like, geez, I'm hot, geez, I'm hot, geez, I'm hot. And do you think like it's a good idea to have your brain be heating up excessively? It's not a good idea. Okay, and then basically the neuron cells start dying from all these pollutants, right? And the interesting thing too is when the jugular vein gets blocked, on MRIs what I see a lot is a lot of fluid accumulation in the frontal lobes. So if you research like brain atrophy or intracranial hypertension, and you're like, what parts of the brain are getting damaged when the brain pressure goes too high? You'll see that it's like the frontal lobe, the anterior cingulate cortex, and the hippocampus, and these are all areas of the brain that have to do with memory, that have to do with high-level cognitive functioning, problem solving, making good decisions. So what happens is when the frontal lobe gets atrophy, that eventually leads to frontal lobe atrophy. When the hippocampus gets damaged, that's what of course leads to memory loss. And then the anterior cingulate gyrus, that's the part of the brain that has to do with problem solving. So in other words, when you have a problem that you need to solve, the anterior cingulate gyrus takes what you've learned from your mother, your father, your own experiences, your moral teaching from church, synagogue, the mosque, all the things that you've learned, and then it's trying to put it all together so you can make a good decision as it relates to the problem that's right in front of you. But if your anterior cingulate cortex is destroyed, then you just make some terrible decision. Like, you know, and this is really happening in the children, in the adolescents, and the teenagers, like one terrible decision after the other. But you could see where people now, they're not making as wise of choices as they should, right? So as the parts of the brain that make us human, the frontal lobe, the hippocampus, the anterior cingulate gyrus, this is what distinguishes us from animals, because we can have courts of law, we have logical thinking, or at least the potential for logical thinking. But when these parts of the brain get destroyed, you have much more animalistic behavior. You have bullying, you have rage, you have anger, you have impulsivity. Like an animal would, if an animal went into another animal's territory, they just go crazy to get them out. So basically, when the jugular veins get blocked, you may start out with just some irritability, some brain fog, but as it progresses, you get dissociation where you don't feel like yourself. You can get severe depression. You can lose a lot of mental capacity. Some people even lose their job. You can't do normal chores, become difficult. So it's a progressive disorder, and often you feel this unbelievable head pressure that won't go away, or you have migraine headaches that nobody can control, and they can't control it because it's not a medication deficiency problem, right? It's not an ibuprofen deficiency problem. It's not a pain pill deficiency problem. It's a jugular vein compression issue. And then basically you could see where high brain pressure and ligamentous cervical instability to structure have similar symptoms: nausea, fatigue, depression, concentration difficulty, blurred vision. There can be tinnitus, there can be balance issues, there can be visual loss. When you have ligamentous cervical instability to structure, the internal jugular vein gets blocked, you have difficulty concentrating on task, eventually problem-solving ability, even normal activities become difficult. Family members, you yourself may notice you have memory problems. The memory problems progress, and then eventually you're diagnosed with dementia. The parts of the brain that get atrophied are, like I said, the hippocampus, the frontal lobe, and other parts of the lobe like the anterior cingulate cortex. And basically this just explains that when the jugular vein gets blocked, basically the lymphatic system in the brain doesn't work so good. So you get impaired drainage from the jugular vein, so you can get swollen lymph nodes in the cervical region. So if you feel like your neck's swollen, it's probably because the jugular vein's blocked, and the G lymphatic system of the brain is trying to drain things into the cervical lymph nodes. And then you get the toxic accumulation of substances such as beta amyloid or tau protein in the brain and the eye. And these are hallmarks for Alzheimer's disease, dementia, different kinds of dementia. And the same process occurs also in the eye. So that's why it's very common in people that I see that not only do they have brain fog, but they have blurry vision. They have visual distortions, might have visual snow, blurry vision, double vision, because the same process is occurring in both. You get breakdowns of the blood-brain barrier, you get breakdowns of the retinal barrier, and because the jugular vein problem also means the vagus nerve is under stretch or compression, you can get leaky gut and all kinds of toxic substances because of leaky gut get into the body, and then you get all kinds of body aching, body fatigue, which we know as chronic fatigue syndrome and fibromyalgia. Again, breakdowns of the blood CSF barrier, and again, it's a perpetuating thing that's ultimately going to lead to death of the brain, or death of parts of the brain, and death of brain cells. And when they do volumetric studies via MRI, there are certain parts of the brain that seem to be more affected by excessive internet use, excessive gaming, all these things. The more visual inputs you put into the brain, the more processing the brain has to do, the more problem solving, the more work the brain has to do. And if the system gets overloaded, right, basically the thing's going to shut down, the brain cells are going to get damaged, and that ultimately is what leads to the high brain pressure. In other words, there's so much fluid accumulating here because they can't get out the jugular vein, like the waste products can't get out the jugular vein, so they go into the brain and they start squelching the brain. It's amazing now when I look at MRIs, because there's not great objective data, if you will, just on a plain MRI of what signifies atrophy. Like there's too little brain tissue there. But I'm just telling you, back in the day, back in the 90s, well, late 80s, early 90s, I worked at Hines VA Hospital in Maywood, Illinois, and what a great training I got. So thank you to all the attendings that invested into me, and the veterans were fantastic. But basically, those were the first MRIs that I really saw. And I'm just telling you, man, I now see young people like in their 30s who have similar MRIs as those veterans who are in their 70s and early 80s. You know, it's not good. I wanted to put up one more slide just to show that ligamentous cervical instability, beside causing high brain pressure, it can have some life-threatening conditions, which we said one was dementia, memory loss, but you can also get problems with the brain stem, the autonomic nervous system, where the pulse goes way, way too low. We've had cases of bradycardia where the pulse rate goes into the 30s. We've had patients who have already come here with pacemakers and they're like 23, 25. We've had people with feeding tubes because the stomach shut down because of ligamentous cervical instability causing vagus nerve damage. We had a patient recently who was basically healthy, then all of a sudden she basically is fainting, she has no energy. She got diagnosed with cardiomyopathy, so her ejection fraction is 10 to 15%. When we saw her especially her left vagus nerve was very degenerated, so we're hopeful as she improves her neck curve and if needed some prolotherapy in her neck, that her neck structure will improve, the stress will go off of the vagus nerve, and then ultimately her ejection fraction will improve. If one Googles like ventricular tachycardia or life-threatening arrhythmias and you type in vagus nerve, you'll see that, you know, vagus nerve damage can lead to all kinds of terrible things on the heart. And of course, when arteries get kinked, and I've seen drop attacks, seizures, even strokes that have a structural neck issue component. I think this really shows what I've been talking about, the effects of visual input on the brain. Like, let's be honest, we're looking at the cell phone, we're looking at the cell phone, we're looking at the cell phone, and the visual input from the cell phone, from computers, from tablets, it increases brain activity drastically. Then all this brain activity creates waste products in the brain. The brain only weighs 2% of the body weight, but it uses up 20% of the energy. So it means even normally the brain activity is very, very high compared to the rest of the body. And then all this extra visual input, because 80% of the sensory input that the brain has to process, the work the brain has to do, comes from visual. Well, these waste products are unable to drain due to the blockage of the internal jugular vein. The visual input significantly increases the amount of waste products in the brain, overflowing it with toxic substances, and because of ligamentous cervical instability and destructure, the waste products can't get out. So you end up with basically a polluted, toxic, neurotoxic waste dump that's basically destroying everybody's brain, destroying your brain, destroying my brain. So what we need to do First is make sure that we're doing what we need to do to have a good neck structure. You know, that's with good ergonomics, good posture, not looking down at cell phones. And then we have to try to reduce our visual input. And I'm sure if we do the combination of those two, many people's healthcare problems are going to go way down. So in summary, something that starts out with just brain fatigue can ultimately lead to something very bad for the brain, like dementia. In my opinion, the way to decrease somebody's risk of that is to have a pro-vagus lifestyle by trying to have joy and thankfulness each day, no matter what life throws at you, because we all get thrown quite a few things. Then 2 is try to decrease the work that the brain has to do by decreasing our visual input, by limiting our screen time. And then 3 is make sure that throughout the day we're actually using our neck muscles. And then if clicking, popping, grinding is one of your symptoms, then consider getting evaluated for ligamentous cervical instability, and if needed, get some prolotherapy injections to thicken and tighten the ligaments.